Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeo-Remedies for problems of lactating mothers. What are common problems of lactating mothers in Bangladesh and India? There are more or less 5 common problems of lactating mothers in Bangladesh and India as follows: leaking breast, engorgement of breast, mastitis, poor or shallow latching by the baby, and poor supply of milk. Number 1, leaking breast. It simply means coming out of milk from breast involuntarily. Please mind that one cannot control it. However, it can be managed to some extent by wearing nursing pads. And if pads are of dark color, the incident might be overlooked by others. That is, this colored pad should better be used in case of necessity. Now, number 2, engorgement of breast. After delivery of baby, milk production increases and pressure of milk in the breast causes engorgement. It can be managed by the following ways: frequent nursing, because as the baby nurses, the milk is withdrawn, naturally engorgement is lessened. Hot and cold fermentation after nursing, that is everywhere it acts. Hot cold fermentation means always any inflammatory or any engorgement places will be relieved. Massaging the breast. This is on the right hand side. This picture is an engorged breast. This is normal breast, and these are the pads actually. Now the mastitis. It is nothing but inflammation of breast tissue due to engorgement, that is insufficient drainage of milk or insufficient or clogging of milk duct. There are so many milk duct in the nipple area. That duct sometimes got clogged due to infection or by something else. Then mastitis also can occur. This should be managed by doctors with the help of proper remedies. This is a pure medical intervention is required. Shallow latching by the babies. This is a very important point. Latching means the catching of that particular nipple by baby's mouth. That is called latching technically. Shallow means it is not proper. This is difficult to resolve. That is, this shallow latching is difficult to resolve to start with. That is, to start with it will be there. But as the baby and the mother become conversant with the small technicalities of procedure of proper latching, generally it is resolved. That is, say for the first day, second day, there may not be proper latching, but gradually it is done. It is practically an airtight communication between the nipple and tongue lips of the baby. This is very much important for nutrition of the baby as well as for mothers. For poor latching causes sore, painful nipples. That is mother's trouble, and it is frustrating to the babies as well. The baby is not happy, and the mother is getting pain and soreness. This is a lose-lose situation. Both the party in combination are in the loss position. In case a mother feels that she is at her wit's end with the problem, that is, she cannot manage this problem of latching, then she must seek advice of doctor as soon as possible, and these advices are easily free, available abundantly. Just ask and you will get the proper instruction. Poor milk supply. This can occur in two situations. Poor latch, because when there is poor latch, the milk is lost. And want of milk production, that is want of milk production by the lady, by the mother, To overcome latching problem, everything has been discussed. That is first point. Regarding first point has been discussed how to avoid this poor latch. Now, poor milk production is not a mechanical problem like poor latch. Poor milk production mechanical, not mechanical, because it is the health or nutrition of the mother herself. This is a problem of proper medication and nutrition of the mother which can be achieved easily, since in the present day scenario a lot of assistants are available. That is, mother may require medicine, vitamins, minerals, so that, and also good to food, that is wholesome food. There will be milk production, normal milk production or abundant milk production will be there. Maybe it is it is in wanting to start with, but when the doctor will attend this, it will go automatically. Calculate curve for problems of lactating mothers. Ulcerated nipples, oozing pus. Mammary glands pain as if they were suppurating, especially on touch. Much adapted to fat, fair and flabby ladies, catching cold easily and longing for eggs. The first two symptoms relate to the disease and the last symptom relate to the person. Mind it, Homeo-Remedies are selected on the basis of both type of symptom, particular symptoms and general symptom. And of them, general symptom is much more important compared to particular symptom. That is disease symptoms. Disease symptoms are less important. Person's symptoms are more important symptom. That they must match with the person. Then only the disease will act. The remedy will act. Salicia for problems of lactating mothers. Nipples ulcerate very easily. They are sore and tender. Pain in small of back. Small of back, actually lumbar region. On the right hand side, this picture, the gentleman's keeping her hands. This lumbar area is called small of back. While child nurses, highly chilly ladies lacking physical and mental grit and suffering from constipation. Sepia for problems from lactating mothers. Nipple crack very much across the crown in various places. Crack very deep and sore. Ladies with bearing down sensation along vaginal tube and lacking vital heat. Chamomilla for problems with lactating mother. Nipples inflamed and tender, can hardly endure the pain of nursing. The lady actually can hardly endure. Milk cheesy, thickened, mixed with pus. Ladies irritable, peevish, uncivil, fly into anger easily. General symptom. Gravitis for problem of lactating mothers. Disposition to fissures and cracks. That is, the lady has the disposition to fissures and cracks, suffer from. Soreness of nipples with small corrosive blisters oozing a thick glutinous fluid which forms a crust that is removed by nursing. The same forms again to disappear. That is, it is forming and disappearing. It is going on. Lycopodium for problems of lactating mothers. Nipples sore, fissured and covered with scarf. Child draws so much blood from the nipples that when it vomits, it seems to be vomiting blood. Milk thin or thick and cheesy. Most of their problem get worse from 4 to 8 p.m. Of there means these ladies. Borax for problems of lactating mothers. Aphthous nipples. Contractive pain in left breast when child nurses the right. Contractive pain in left breast when child nurses the right. Disagreeable sensation of emptiness in mammy after nursing, obliging her to compress the breast with hand to relieve from that disagreeable sensation. Ladies generally suffer from excessive hot albuminous leukorrhea. Sulfur for problems with lactating mother. After nursing, the nipples smart and burn. It chaps badly about the base and bleeds. They crave, that is the ladies crave sweets, fat, acid, alcohol, beer. They are very hot patient, like to wear very light dresses. Pulsarilla for problems with lactating mother. Mothers weep as often as he has to nurse. Pain extends to chest, neck, down the back. Pain moves about. They are soft, yielding with weeping disposition and thick, bland discharge. That is, their bodily discharge are thick and bland. Mercurius for problems with lactating mother. Nipple very raw and sore. Sensitive gums, sore teeth with enlarged cervical glands. Their bodily discharges are acrid, fetid, having thirst for large quantity of water. They sweat easily, they means the ladies, without any relief. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write it in the comment section. I would certainly attend.